I think the number one mistakes that I've seen other startups making is that they become overly focused on looking like a startup, on doing all the things that startups do, trying to raise that next round of funding, trying to build up excitement among investors, which often is short-sighted because once they've raised the funding, then often the fundamentals of the company aren't there. And so they're trying to do whatever it takes to get investors, even though sometimes that actually ends up restricting them from being able to build the thing that they're trying to build in the long term. I tried to launch one myself several years ago. And the biggest mistake that I made at the time was not working with the right people. I worked with the people that were convenient to work with.
Dr. Siddiqui, welcome to the Entrepreneur Next Door. Please introduce yourself.
My name is Sean Siddiqui. I'm a neuropsychiatrist. I'm a researcher at Harvard Med School and at Mass General Brigham hospitals. I spend most of my time trying to figure out how to use these new uh, techniques in psychiatry we call electromagnetic brain stimulation. So to use brain imaging to figure out how to target these innovative new treatments.
And you're a Harvard professor. You train in psychiatry. I'll dig into that in a couple of minutes. If I read into you when you were 16 and said, Sean, what do you want to be when you grow up? What was the answer back then?
Oh man, it was something different every week. I think if you'd caught me in a good week, I would say I wanted to be a computer programmer. There was another week when I might have said I wanted to be a CEO. There was one thing I would not have said is that I wanted to be a psychiatrist or a doctor even. I absolutely was convinced I didn't want to be a doctor. I wanted to go into business or computer science. So it was a change in directions that led me to where I am, although I'm very happy with it.
So what were your parents doctors or they're
No, I come from a long line of engineers, and the one thing that everybody told me is, Sean, do not become an engineer. So I said, okay.
okay. So what was the like turning point that got you back into the world? You said, I'm not going to be a doctor.
Yeah, I was immature when I was 16, right? So I didn't want to be a doctor because that was the 16-year-old version of myself that didn't really understand what I was saying no to. And of course, my parents wanted me to be a doctor because who doesn't? And at some point in college, I told my mom definitively, nope, I'm not going to do this medicine thing. I think I might go into biotech. I learned a little bit about biochemistry in college. I like this, but I want to chase the business side. She said, okay, I think that you just don't want to do the work to get into medical school. And so here's what I'm going to tell you. Prove to you, you can prove this to me. If you get into medical school and then decide not to go and go do an MBA, I will support you. And so I said, okay, I'll do that. So I got into medical school. And once I got in, I realized that she was right. The only reason I didn't want to be a doctor is because I didn't want to do the work to get into medical school.
Hey, well, clearly I'm not a doctor, but I have my oldest daughter is, and I kind of have a sense to the long journey to get there. And interestingly, as we dive into your specialty, when she was applying to college, she's pretty smart, very intuitive, but she did say to me, so Dad, what do you think I should major in? Because most kids go into college not really sure what they want to do. But she asked me. So I said, look, I've been obsessed with the human brain all my life. I think this part of the body will experience the most disruptive changes and discoveries, neuroscience.
No, I agree. And I didn't discover that until a little bit later. So when I first decided to go into medicine, I did it for all the practical reasons. I wanted a career that is intellectually stimulating, gives me a stable sort of control over my life, that allows me to make a positive contribution to society every day. The same reasons why everybody goes to medicine. But it wasn't until the first 2 or 3 years of med school I thought I'd made a mistake. I said, I don't like this stuff. I knew I wasn't going to like this stuff. I shouldn't have done this. But I borrowed too much money to go to medical school and I couldn't quit at that point because I wouldn't be able to pay off my student loans. So I said, fine, I'll stick with this. I'll get some job. I'll pay off my student loans. And then maybe I'll try business again, or maybe I'll go into become a writer or something. Who knows? Then I did my psychiatry rotation and everything changed. As soon as this was toward the end of my third year of medical school, as I went in and it was the first time I've just fallen in love with something where I started doing it and I said, I love this so much that I absolutely know this is what I want to do for the rest of my life. There've been two times in my life that's happened. One was when I did psychiatry, Number two is when I met my wife. And
You,
yeah, that was also the first day that I met her. I knew that she was right for me. It was the same thing with psychiatry. The first day that I did it, I was like, this is it. And aside from that, every other decision I've made in my life has been hyper rational. But I immediately knew that this was the fact that you can figure out ways to help people by treating the brain without yet understanding the brain. It was fascinating to me for multiple reasons. One is being able to treat something you don't understand. Sorry, the thumbs up was the automatic
right.
thing. One is treating people something you don't understand, and number two is the quest to understand it.
By the way, what is it about psychiatry that intrigued you so much, right? So for those of us who are, you say psychiatrist, you immediately think laying on the couch, today it's sitting in a chair and somebody in front of you with a yellow page taking notes, right?
Yeah. One thing about psychiatry is that it never gets boring. Everybody's story is interesting. I vividly remember one of the first few days on my psychiatry rotation in med school, where I was sitting there talking to a patient for hours about every single thing they had to talk about. And this person had schizophrenia, so they had a very disorganized thought process and they had difficulty constructing a story. But it was still incredibly fascinating to me that everything that comes out of this person's mouth helps me better understand how I'm going to help him. And I had to pay close attention and integrate it all together. And I like that compared to other specialties of medicine, because in other areas of medicine, there were maybe three or four pieces of information that really mattered. And the rest of the time was figuring out how to get that information. Like, I know their blood pressure. I know whether they have swelling in their legs. I have their cardiac ejection fraction. I now know what medication they need. Whereas in psychiatry, you really had to understand everything because we didn't have strict guidelines, because the things are get to be so complex. And so it was that complexity and that lack of that ambiguity that fascinated me. That was one thing. The other one was, like I said, I was fascinated by how little we know about the brain and how much we had left to learn about it.
Mm,
And then
amazing.
also, like I
So
said, a huge part of it was just love. It was something that I couldn't put a finger on. It just happened that I said, this just feels right.
I think the way I presented to you is let's talk about what I call the last frontier in the human body, which is the brain, because that's your specialty. I still can't believe I'm talking to a Harvard medical doctor professor. It's amazing. Um, is this the new human body disruption after the mapping of the DNA? Because that was a big deal, right?
You're not the first person to say this last frontier thing. And this is, like I said, one of the reasons why I studied this stuff. There are a lot of different takes on it. Personally, I'll say something that some neuroscientists are going to find controversial, which is that I don't think we're ever going to fully figure out the brain. I think humans will go extinct before we understand all of it. We won't fully map it out. The question is, the challenge for scientists is, how can we find treatments for brain disorders without fully understanding the brain? And so we spend a lot of time finding shortcuts to say, I don't fully understand it, but I partly understand this part. And I know which treatments work. And so I can build models to figure out how to reconstruct effective treatment. So the analogy I often make is that, similar to how ChatGPT figured out what we call AI, ChatGPT is not actually intelligent. It doesn't actually understand the question that you're asking it. Machine learning algorithms were more intelligent for a long time. You could train a machine learning algorithm to understand the variables that went into any given problem. But then you'd need 100,000 machine learning algorithms to ask 100,000 different questions. Whereas ChatGPT can ask millions of questions without understanding any of them. Why? Because it crawls the data of all prior human communication and figures out how humans have answered the same question in the past, and builds an answer to it without understanding it. So I think one of the big challenges in neuroscience right now should be, how do we build similar models that can come up with ways to predict outcomes or to find treatments without fully understanding it? Because I think the trillions of connections in the brain are, we have, we haven't even skimmed the surface after decades of and billions of dollars. We don't understand. We're not even close to understanding it. So I think we won't get there. I think we'll instead come up with shortcuts.
But yet, if you look at your LinkedIn profile, and I would encourage everybody to go look at it, it will be in the show notes. There's an image of the brain, and there are centers with arrows to them. One says depression, right? Addiction. So you are able to identify areas in the brain that are, okay, what's responsible for certain types of behaviors, I guess, right?
Yeah, and so this is an example, right? I don't know why those parts of the brain are responsible for those behaviors, but what I do know is that I can treat those behaviors by stimulating those parts of the brain. And without fully understanding every little mechanism, to understand a mechanism, you have to chart it down all the way to the molecular level to say that I know that when I stimulate this, that leads to this cell to interact with that cell, to interact with that receptor, interact with that molecule, and that's how it happens. I can't answer that question with the brain. I can do it in the heart or the lungs or the muscles, but not in the brain. What I can do is say, like I said, if I target this area, the addiction will get better. If I target that area, the depression will get better. And so we've built up models using large scale wiring diagrams of the brain. Like there's this tool called the human connectome, which was we hoped would be like the human genome. Turns out it's a little more complicated, but it allows us to figure out what's connected to what. And so if you had a roadmap of the human brain, it would help you figure out how to get from your house to the airport, but it wouldn't tell you how your car works. It wouldn't help you figure out how to build a new car. And so what that picture is. It's like a map to say, how do I get to these different parts of the brain if I want to target them, even if I don't really understand how the underlying mechanisms work.
Okay, so here's I'll call this the $1 billion question, the nature versus nurture question for you.
Yeah.
I have a brand new granddaughter. I think you have a child also, right? Um,
Congratulations, by the way.
thank you. So when they come out of the womb and you hold them in your hands, they have a brain.
Yeah.
Are those centers of the brain already there? They're just not activated, and something later on triggers them to fire off? Or is it something that's not there and then somewhere through neural connections because of hormonal imbalance, the biology, or environment, this happens, right? You probably could talk about this for a semester, but this is like, I'm curious.
Yeah, I'll give you a not very satisfying answer to the question, which is both. It's definitely not just nature or just nurture. But the more sophisticated answer is that we know that there are some behaviors that are more nature and some that are more nurture. And if your listeners are interested, I think the person who's done the best work on this topic is Robert Cloninger, who is a personality biologist and a psychiatrist. But for example, there are some behaviors that are inherited that are evolutionary adaptations, such as harm avoidance or novelty seeking. Those are things that it makes sense in the population, in any human population, to have some people who have more of that and some people who have less of that. You want some people to be very novelty seeking so they can discover new areas, new things. You want some people to be not very novelty seeking so they can protect your population and keep them safe. And you want them to be more harm avoidant. So that the evolution has built those systems into our genetics so that some people have more or less of that. And those are nature things. Those are things that are very clearly inherited from your parents, those traits. You don't really change them that much. Uh, then there are other traits that are learned with social development, like cooperativeness and self-directedness and also self-transcendence were some of the ones that Cloninger identified. But there are many others potentially also. And what he noticed, this particular personality expert, was that if we just look at inherited traits, harm avoidance, novelty seeking, other ones are reward dependence and persistence, if you just look at them, then CEOs look just like sociopaths in prison. They have the exact same underlying nature. The difference is nurture. The CEOs, they've learned how to use those things and become in a cooperative manner and in a self-directed manner. Whereas the people who end up criminals in prison are the ones who never learned how to use those traits properly. So in short, there's some traits you're born with and other traits that you learn. And that can have a huge impact on how you end up developing as an adult.
Yeah, it's just like in my notes that I'm looking off to the side is after studying you, and I spent a lot of time studying my guests before I go on this, I called you the brain Sherpa. And that you keep proving it. So if I got this right, doctor, your expertise comes in a point where medication and what they call talk therapy with traditional therapy uh, no longer are effective, right?
Right.
Is that, and then again, before you answer it, I want to jump in. If you can explain it to an 8-year-old, there are a couple terms that I came across that are part of your specialty: TMS, DBS, right? So maybe it's the tech that comes in when medication and talk therapy no longer work.
Yeah, yeah, exactly. And to clarify that, there are many different types of effective talk therapy, many different types of effective medications. And when I'm seeing a patient, usually those are the first few things we recommend because they're easy for people and that's what people like. And so you give people both options. Like, here are the medications I can offer you. Here are the different types of therapy I can offer you. Which ones would you like? And people make that decision. When those things don't work, we have an emerging field of targeted brain stimulation. What that means is that I have a sense for which parts of your brain might not be working as well as they should based on decades of research on neuroanatomy. And I can activate or inhibit those parts of the brain with either non-invasive techniques, like the one you mentioned, transcranial magnetic stimulation or TMS, or invasive techniques like deep brain stimulation or DBS. We avoid doing the invasive ones because they're invasive, they require neurosurgery. But TMS is the one that we use most often. Essentially, it's an electromagnetic pulse generator that can selectively activate specific circuits in the brain. As you might know, the brain sends most of its signals via electrical circuits. And as you might also know, you can manipulate an electrical circuit with a magnet. There's the principle of electromagnetism, which was uh, Faraday's principle of electromagnetism. So by following those principles, we can use these magnets to penetrate the skull and activate specific circuits in the brain. Uh, it's a very safe treatment. The reason why it's so safe is because you're actually capable of activating your circuits on your own by just thinking about it. But it's hard when that circuit isn't working properly for you to activate it on your own. It's just like if you were to injure your arm and somebody were to say, all you need to do is do arm exercises and that'll fix it. It's hard to do arm exercise because your arm is in pain. And so then you go to a physical therapist and they might use some special equipment and they help you do the exercise so that you can exercise the muscle without undergoing pain. It's similar to that, except we're doing it to the brain. So we're activating circuits that you're not able to activate on your own so they can repair themselves. And so as a result, it ends up being quite safe and it's actually more effective than most of our medications and psychotherapies.
Amazing. So we'll slowly walk into the business aspect of this whole thing, right? As you were talking, I'm thinking, are we going to get to, at some point, to an intersection where you'll implant a tiny little electrode, a nano electrode in an area that's maybe responsible for addiction, and it will fire off when that center has beyond average activity, which shows that you're going to do something stupid, right?
Yeah, so that's actually already being tried. What you're describing is something that's called closed loop deep brain stimulation. It's already being done commonly for epilepsy. There's a tool by the company that makes this is called NeuroPace, and it's called RNS, or responsive neurostimulation. Basically, they have electrodes in the parts of a person's brain that commonly trigger seizures, and it'll sense a seizure and it'll send an electrical pulse to stop the seizure before it happens. It's very effective and has become very popular in recent years. Now, people have also been trying to apply it to things like depression and addiction and all these other PTSD. PTSD is a popular example that when you're about to have a flashback, it tries to detect the flashback and send a pulse to stop it before it happens. Thus far, it's only been uh, done in a small number of people, so we're not sure if the successes were a fluke or if it's really going to work. But there's some promise that we might be able to do that. It's a step beyond what I was just telling you about. It's not just stimulating the brain, but it's stimulating the brain only in the moment when it needs to be stimulated.
Right. So it's reactive to whatever's about to happen, right?
Like,
Those signals. Yeah.
yeah. If you're interested in learning more about this, like I said, it's called closed loop deep brain stimulation. Closed loop because part of the loop is that the signal is sent, the device captures it, and then sends a signal back again to close the loop to stop it.
Amazing. So the two parts on your LinkedIn image that are very common, because every one of us knows someone who is depressed and someone who is in addiction. Let's talk about alcohol primarily, because that's so common, right? Well, again, some people say that addiction is hereditary, right? I don't know if that's true or not. I mean, you can tell me. It's
There,
probably, is it?
yeah, it's very clear that if you take twins that were separated at birth, if their parents suffered from addiction, if their biological parents suffered from addiction, they're more likely to develop an addiction, even if their adopted parents did not suffer from addiction. So a lot of times people think that, oh, maybe it's not genetic. Maybe it's just that you grew up around a lot of addiction and that's what influenced you. But no, even if you were adopted, you're more likely to be like your biological parents than your adopted parents in terms of addiction.
Yeah, I remember those studies in when I was in undergrad psychology. That was fascinating. So does that then confirm that we're born with and forgive me for simplifying because I'm not that smart, but we're born with an addiction center in the brain that is activated, but is it the nature that the nurture that activates it? So is it your lifestyle, what you're exposed to? You can have, so you can be, if your parents were, so let me rephrase. If my parents were addicts and I'm born with that, we'll call it the brain gene,
Yeah.
what's the probability that I'm going to wind up in an addictive behavior?
Yeah, I don't know the exact number, but it is much higher than it would be for somebody else. Now, like you were hinting at, there are many factors. First of all, like you were saying, of course, the idea of having a brain addiction gene is a bit of an oversimplification, but it's a reasonable model. In reality, it's an interaction between multiple different genes. For example, the same guy I was talking about earlier, the personality expert Cloninger. He identified two types of alcoholism, which he called type 1 and type 2. One type was the people who start drinking when they're in their teens and 20s because they're trying to have fun. They binge drink, and those people have a novelty seeking personality. And as I mentioned earlier, novelty seeking is an inherited trait. And so people who have high novelty seeking are higher risk for developing alcoholism in their 20s. And there's a separate group of people who have harm avoidance, and which is also an inherited trait. And those people don't drink to have fun. They drink to drown their anxiety, drown their sorrows. And for them, the addiction doesn't usually develop until a little bit later in their adulthood, like maybe in their 40s. And there's that's also inherited. And again, so that person who developed alcoholism in their 30s or 40s, their kids are also more likely to develop it in their 30s or 40s, even if they don't even know their parents. And so, yeah, that definitely exists. But then, of course, nurture is part of it too. If you look in cultures where alcohol is not available, alcoholism is a lot less common. But alcohol exists there, but most people are never exposed to it. So if you're never exposed to it, you're never going to drink it. There's But other drugs become more common. For example, I'm originally from Pakistan, which is might be one of the few countries where opiate addiction or heroin addiction is more common than alcohol addiction, because both substances are equally taboo there. Whereas here in America, alcohol is acceptable and heroin is taboo. So people drink way more alcohol than they do heroin. In a culture where both are taboo, heroin becomes more common. And so it's so that there's definitely a huge cultural component to it, what things you're exposed to in your culture. There's also a biological component just to the exposures. For example, there was a mouse study where they showed they looked at great groups. Yeah, they looked at multiple different groups of mice. And of course, it's hard to translate mouse studies into humans, but in this case, they did a pretty good job. Many of the mice were essentially genetic clones of each other. They were like twin mice, but large groups of them. There was a group of mice with one particular gene. If you exposed them to cannabis and then gave them the option to have cocaine, you gave them cocaine and they would work a certain amount of effort to try to get the cocaine. If you had exposed them to cannabis, that didn't really change how hard they worked to get cocaine. There was a different group of mice, but when you exposed them to cannabis, that made them work harder to get cocaine. And there was a third group of mice that didn't really care about the cannabis or the cocaine. And the only difference between those groups was a specific gene that's been known to be implicated in reward. So this suggests that for some group of people, the gateway drug phenomenon is also real. Like when you expose them to some drugs, they're more likely to be receptive to other drugs. And there are some people for whom it's completely meaningless. That there's no such thing as a gateway drug for that other group of people. Of course, human behavioral genetics are more complicated than mouse behavioral genetics. So we don't exactly know what these genes are, but there is this complex interplay where both nature and nurture come into it.
It's fascinating and scary. So if you have heart issues, when you go to your doctor, the cardiologist, the first thing they ask you about family history of cardiovascular disease, right? If you're an alcoholic, you have an addiction to alcohol, is the first question then, hey, were your parents alcoholics?
Yeah, it's just as important as it is for cardiac issues. It's a very common question if I'm seeing a patient with who's been struggling with addiction is what is their family history of addiction or mental illness in general. And in fact, it's one of the most important questions that I'll ask patients, regardless of what psychiatric problem they have, is what runs in their family.
The crazy thing just popped into my head because that's what makes this fun. The thing that intrigues me, Robin Williams was to me one of the most amazing comedians that ever lived. Right, he was incredibly funny. He was great on improv. Right, if you're familiar with him, he was incredible. Right, um, and then he goes and commits suicide because he suffered from deep depression, that's a kind of recurring theme, especially among people who are very successful. That's sort of like my introductory way into entrepreneurship, which is what this podcast is about, right? So we have business owners who start businesses, start companies, hopefully with the intention to make a difference in other people's lives, and then things go well and they become very successful. Money is no longer an issue, right? They have a lifestyle that people would die to have. And yet, whether it's comedians or celebrities that are super successful, suffer from deep depression. And so for those of us we're not in the field, please explain it, doctor, because I don't get it. I mean, if you've got everything in life that everybody else would want, why do you wind up killing yourself because you're so depressed?
It's a disease, and this is a great evidence of the fact that it is a disease. It's the systems in your brain that are responsible for making you feel satisfied or content are just not working. And it doesn't matter how good your life is, you're going to be unable to appreciate it. In fact, a lot of the people who are suffering from depression, despite being wealthy and successful, that's an added source of guilt. They'll come to us and they'll say, I have everything that I ever wanted, yet I still can't, and I still have no sense of reward and satisfaction. And I feel guilty about it because so many people don't have anything and they can be happy. So why am I not happy despite having everything? Like I said, it's an added source of guilt and it makes them feel even worse about themselves. And
So
it's
what do you tell them, doctor? I mean, if I was a successful entrepreneur that have everything I want, right? Uh, and I'm sitting in front of you and I'm saying, I'm miserable. I'm really, really unhappy.
yeah.
What do you tell me that let's go check you for depression, the gene, or are there other things you can do to overcome it?
Yeah, so the genes are complicated. There's no one single gene. There are many different genes that can do it. So we can't just check for the gene, unfortunately. What I usually focus on is helping them understand that this isn't their fault. They're not choosing to be unhappy. They're not ungrateful. Their brain is just there's a system in their brain that's just not working. And there are a few ways to bring it back. Again, it's just if you had a broken bone, it's just not working. No matter how much you want it to work, it's not going to work. And so there are a few things you can do with a broken bone. You can get it set. So similarly with brain stimulation, or sorry, with depression, we can give you medicine that'll help you recover. Well, when you have a broken bone, maybe it's not so bad that you need an orthopedic surgeon. Maybe it's just a hairline fracture and all you need is physical therapy. And similarly, we can send people to psychotherapy to work on some of these things. And like I said, we have brain stimulation also. So the big thing that I try to get people to understand though in that situation is that this isn't their fault. This isn't something that makes them a bad person or that reflects in any way on their character. It's something that is happening to them, partly as a result of genetics, partly as a result of other factors that can be helped. Uh, one of the first, this might actually be more common sometimes in highly successful people because one of the things that happens is when you're not happy with your life, sometimes you work harder to try to compensate, to try to achieve stuff. You think maybe I'm not happy because I don't have enough. And so you work hard to get more. Whereas somebody who is happy might be less inclined to fight for more. And that's good for that person. It's sometimes bad for the person who's constantly thinking that if I get more, maybe it'll make me happy. It doesn't work. So one of the first things they taught us in medical school and on the orientation day actually was many of you are here thinking you worked really hard to get into medical school. You're going to go through medical school. You're going to get through a residency. And then you're going to look back and say, my 20s are gone. I spent my entire youth working towards this. And after I'm done with this, I'll be happy. But you're going to realize after you get there, that's not what makes you happy. you'll feel no different from how you did before. Your success in medicine will not bring you happiness. It's going to come from somewhere else. So the career is just is something independent of that. And I took that to heart. And I think it was absolutely right. I've seen this happen to many of my colleagues where they tied their happiness to finishing training. And one of the most sad cases of this I think of was a neurology resident who was a year ahead of me in training. He supervised me when I was on my neurology rotation in residency. And very nice guy, very helpful. He always used to send me home early. I was a first year resident. He was second year. Usually, the second year residents would use the first year residents to do all their boring, busy work. And he never did that. It would be 4 p.m. and he'd say, Sean, why don't you go home? I'll take care of all the work. And I was like, man, this is the nicest guy ever. Nobody ever does that. His fourth year of residency, he killed himself, committed suicide. It was horrible. And it was especially horrible when you think about the fact that he went through 4 years of college, 4 years of medical school, and 4 years of residency, and he was almost done. He was a few months away from being done with this rigorous, extensive training. And that's when he decided that it was time to end his life. And I imagine what was going through his mind. I don't know. He didn't really tell anybody about it. We all knew him, and it was, of course, an immensely tragic event. But it was what was amazing. People kept asking this question: is that why would he do this towards the end of his training? And I think this was part of it, is that he was realizing that he'd been tying, this is my hypothesis, I don't actually know. Maybe he was tying his happiness to being done with training. And then as he was finishing, he realized that nothing was changing.
So if you look, I think the number one killer in the US is heart disease, right? Followed maybe by cancer.
Yeah.
What are the numbers for, or are the numbers for people suffering from addiction? Let's forget addiction, like just depression, which is probably much more prevalent and common, right? Are they able to capture those numbers and say this is like the other, maybe not silent killer, because not everybody with depression kills themselves, commits suicide, but
It disables you in many ways, but even with suicide. Yeah. Even though suicide is not one of the top causes of death across the whole country, it is one of the top causes of death among young people. I think suicide, between the ages of 15 and 40, I think suicide is the number one cause of death in the US. And so because of that, it ends up being, of course, not to discount the terrible impact that heart disease and cancer have. Those are hugely horrible things that tear apart families. But usually they take people who are older. Not always. They also often take people who are younger. But so if you actually quantify the number of years of life lost due to death and disability, the World Health Organization actually counted this and found that depression was number one and anxiety was number six.
yeah, and I'm sure those numbers are through the roof with social media and all the other stimuli that
Yeah, it
everybody.
seems to be
So
getting worse. Addiction is also getting worse. So you're right that depression has always been seen as more common than addiction. But there's been an opioid epidemic, as I'm sure you've heard about. People talk about it all the time. Addiction is unquestionably getting worse in recent years.
yeah, so when we met, you're very much sought after because of your expertise by entrepreneurial founders and ventures in people that are starting new companies, trying to implement the type of technologies and knowledge that you have. So without talking about who they are, you've been exposed to them already. You've dabbled. You have your own little adventure. Um, what do you see from, and this is now the business part of things, right? What do you see as maybe the number one mistake these startup companies make?
I've worked with several startups. I think what the biggest mistake, and I tried to launch one myself several years ago. I think the biggest mistake that I've seen people, sorry, the biggest mistake that I made at the time was not working with the right people. I think I worked with the people that were convenient to work with. And I was thinking at the time that, hey, I don't know if my idea is that great or that exciting. I don't know if a real experienced professional CEO is going to want to work with me. So let me just ask my friends if they know anybody. And so then I ended up just working with a friend of a friend as a CEO and a friend of a friend as a COO. And we started trying to launch something. And they were inexperienced. And in retrospect, maybe I was right. Maybe my idea wasn't that great, or maybe it was. But if it wasn't that great, then I shouldn't have been launching a startup around it. If it was that great, then other people would have wanted to work with me. They're like qualified people. So what wasn't the right decision was to say, I'm going to work with unqualified people just in case my idea isn't good enough. I should have had more confidence around it. So that was the number one mistake that I made. I think the number one mistakes that I've seen other startups making is that I think they become overly focused on looking like a startup, on doing all the things that startups do, trying to raise that next round of funding, trying to build up excitement among investors, which often is short sighted because once they've raised the funding, then often the fundamentals of the company aren't there. And so they're trying to do whatever it takes to get investors, even though sometimes that actually ends up restricting them from being able to build the thing that they're trying to build in the long term.
The other thing is because some of the people that you're working with, they have to use technology, whether it's TMS or DBS, right, to stimulate the brain. So there's a significant amount of tech built into this, right? And for me, of working with different types of companies, especially in the IT world, I always tell the founder, stop falling in love with your tech. The tech doesn't matter. It's a tool. It's really the patient experience is understanding what is it for the from a person from a patient perspective, right? Are you solving my problem? The tech
Yeah.
is there.
That's definitely another mistake that I've seen happening is that people in certain startups, they become married to a specific piece of technology. And as any layperson can tell you, technology changes, technology iterates. And so if you're saying that you're a company that only builds one specific thing, what happens if somebody builds a better version of it? Do you
Mhm.
give up or do you keep fighting it? Or what if your thing turns out not to be as good as you thought it did? But it was. Do you fold at that time and launch something different, or do you pivot, or do you keep trying to convince people that your thing is good? And I've seen a lot of people making that third decision, unfortunately, where even after evidence comes out that their thing is not the best, or somebody else comes out with a better thing, they keep trying to sell their thing and trying to convince people that it's a good thing. But I think it comes down to exactly what you were saying. I think sometimes people are launching and running their business not because they're trying to solve a problem, but because they're trying to make money. And it's fine, make money. Obviously, everybody wants to make money. I'm not saying we should work for free, but if your goal, if you start to prioritize the benchmarks over the actual end goal, then you'll end up hamstringing yourself. There's a famous quote that I'm sure people have heard before. I'm sure business students probably use it all the time, that when a metric becomes a goal, it ceases to be a good metric, something like that. And I've seen that happen lots of times. That, for example, if you're incentivized, this is something that's happened to me before, where I was incentivized to come up with more IP for a company that I was consulting for. And it made sense that it seemed like a reasonable incentive for the science guy to be asked to do more IP. But then what I found myself doing was writing IP just for the sake of writing IP, because that's what I was incentivized to do,
Yeah.
rather than thinking through what is the best possible thing that I can build. And if IP arises in the process, then it arises.
All right. I know you're busy. I could probably spend a really long time with you. There's so many more notes I have. Just a couple easy questions. One, so what does Dr. Siddiqui, who is a psychiatrist, expert in brain stimulation, do for fun to avoid being unhappy or depressed?
I just had a baby, like you said, so I spend most of my time doing that. My wife is actually a medical student. When I say that, people think I'm married to a 25-year-old, but she started a little bit late. So she's gone back to school to study medicine, which means that I spend more time with the baby than I shouldn't say more. I spend a lot of time with the baby, which is I never thought that I would be that guy that looks forward to that. I thought I want to have kids. I want to have kids because of pragmatic reasons, like you should advance your gene pool. You should have somebody take care of you when you're old. And I'll be a good dad because that's the right thing to do because I care about moral values. And I think that you should push the world forward. And that's the right thing to do. So that's what I'll do. Here's what happened. Like I've got this 6-month-old kid and we just started sleep training him. So now he goes to bed at 8:30. So I get home from work at 5:36 sometimes and he goes to bed at 8:30 and I miss him. It's not enough. And I'm like, why are you going to bed already? Yo, stay up, little. And so I think I never thought that would happen to me, but I guess I'm just like everybody else, and which I appreciate. Every once in a while, like people make fun of me for being a robot, for being a computer, and so it's always reassuring to me when I'm reminded that I'm actually a human. But before that, well, the other thing is that I've always liked playing guitar, but ever since I got married, I think I'm a little bit embarrassed to let my wife see because I like doing it, but I'm not that good. My son, however, can't tell the difference. He's not sophisticated enough to be able to tell that I'm not that good of a singer. And so now I've gotten back into that too.
Amazing. I'm absolutely shocked that your wife went back to med school and you have a 6-month-old baby. And I'm going through with my granddaughter. She's now 2.5 months. And I mean, we kind of forgot the routine and the 3 hour cycle of feeding and not sleeping. And I mean, my daughter and her husband, but we help out. It's fascinating, but it's a lot of work. It's a lot of work. I don't know how you go to med school and you have a 6-month-old, you have a baby.
It was fortunate that I'm at the stage in my career now where I can step back a little bit because most of I have a lab, most of the people are doing their own thing. I'm not sitting there doing experiments anymore or writing papers. I have trainees who do all that, and I just supervise. So it's that makes it a lot easier for me to spend the night with the baby and have to wake up in the middle of the night and stuff.
All right. So last question. I'm giving you a billboard in Times Square, New York City, and you get to put anything you want on it for people, millions of people to walk by and something that is going to resonate with them. It could be to business people, it could be to the average human being. What would Dr. Siddiqui put on there?
Good question. I've never thought about that before. I think it would have to be something about, I'd have to think through the best way to market this, but the theme would have to be something around destigmatizing mental illness. Well, what would be the catchphrase? Maybe something along the lines of "we all struggle," and maybe with a nice picture to describe it. We all have different kinds of struggles with mental illness, either directly or in our immediate families. It's very common, as you said earlier. We all have been touched by somebody who struggled with depression or with addiction or with something else like that. And so, just to remind people that it's not just you. It's extremely common. It's one of the most common causes of disability around the world. And it's something that we have treatments for that we can help with. So I guess that's my catchphrase for now. We all struggle, but I
So
don't.
maybe we'll add the word "it's okay to struggle." Right.
Yeah, there you go. So that's why I need to collaborate with business folks.
Okay. All right, Dr. Siddiqui, this was fascinating. So anybody who wants to understand the tech behind the brain and everything else about you, I will include all the connection links in the show notes.
Yeah, thanks for having me. This is fun.
Pleasure. Okay. Thank you.